Bismillahirrahmanirrahim. Now let's go to the integrated anatomy station. We'll here discuss only about the anatomical part. So one anatomical part is about your anterolateral abdominal wall. So you have to know, for that we are going to provide you with the image, and you have to know about the different muscles of the anterolateral abdominal wall along with the anatomy of the inguinal region. So where is the superficial ring, where is the deep ring, how is the inguinal canal is formed, what are the structures of the inguinal canal, what is the difference between inguinal hernia, femoral hernia, and all these things, mostly the theoretical part. Now let's move on to the liver. So you have to identify this organ. So this is liver, and then you have to identify the different parts or the different lobes of the liver. So where is the, you might be asked to put it in the correct anatomical position. So you have to make sure that what is the normal anatomical position, that it is below the right costal margin. And then you have to identify the different lobes, like say this is the right lobe and this is the left lobe of the liver, with the help of this ligament, which is the falciform ligament, which is coming from the anterolateral anterior abdominal wall. And then they have the two layers, and then as you trace these, they might ask you about the peritoneal reflection. So this is one of the peritoneal reflection on the liver, which is the falciform ligament coming from the anterior abdominal wall, and they have two layers, the right layer and the left layer, and as you move, they diverge from each other. The right one goes to the right and they form the bare area of the liver. Similarly, the left, it goes to the left and then it moves again, and they form the left triangular ligament and the right triangular ligament. This one is the bare area of the liver, which is not covered with the peritoneum. Similarly, this is another bare area of the liver. Now this is anatomical division. You might have another division that I have already told you, that there is a surgical division. So you have to know about how to make it surgical division. Actually, it is clockwise direction, 2, 3, 4, 5, 6, 7, and so just go through the surgical division of the liver. Now, what are the other important things that you have to know? Apart from this, we have two different surfaces. One is called diaphragmatic surface, which is having anterior, right, lateral, and superior surface. So one is the diaphragmatic, this all together called diaphragmatic surface, and then we have the visceral surface here. Now, apart from this, you have to know about the another different lobes. One is this one, the quadrate lobe, which is start from Q, quadrate lobe, which is adjacent to the gallbladder, and then we have the quadrate lobe, which is adjacent to the inferior vena cava. Now, apart from these two, there is one very important structure, and this is called porta hepatis. So what are the content of the porta hepatis? This is the tributaries of the portal vein, hepatic artery, and hepatic duct. And then they'll ask you about, in the visceral surface, they might ask you about the relations. So in the right side, you have, here we have the right kidney, right suprarenal gland, and on the left side, we have the stomach here. So please remember all these things, the visceral relation on the visceral surface of the liver. So this is about the liver.